So from a patient portal view, this is patient-facing healthcare, not patient gets a fax or a PDF, a printout from the EHR. This is the patient-facing portion. So all of the medical history of the patient and their family, because this is always going to be treated at the family level. That's how support works and community works. Whether it's a daughter-in-law taking care of an aging parent, or it's a child, or it's a spouse, it doesn't matter. It's all about families. So the medical history of the family, and that includes every service rendered, plus every diagnosis and every treatment plan that you've been on, plus any genetic information submitted, and all the above. And this just builds over time and stays with the patient forever. A personalized care plan. So this is using that medical history plus sort of whatever acute thing or chronic thing is going on, and personalizing a care plan, and then proactively checking in with the patient. So you're never alone. So this sort of helps in a lot of ways. This for medication adherence, for example, for therapy at home, for any at-home service, really, you want an AI interaction to monitor the patient, because you can't afford to have people show up at the door, and you don't want to have a big hospital building full of patients that could be at home. And then finally, claims and payments. So you'll easily be able to see what is being billed and what is being and payments that need to be made by the patient. One of the areas that I think is really interesting with this is from the insurance view, which we'll talk about in a little bit, but how to control spend, which is really where the money is when you're talking about sort of the federal plan level. The commercial plan, they make sort of a tax on every transaction, so they can make it work. But when you're capitated or doing a Medicare Advantage plan, those kinds of things, or Medicaid state trying to get better outcomes with a difficult population, this is important.